Hello and welcome. My name is Miriam. I'm going to be recording this presentation on behalf of Dr. Lawrence from Uganda and Dr. Kinlabi from Nigeria. The topic is going to be: should AI be integrated into national genomic policies to improve diagnosis and data analysis, or should its use be restricted until ethical concerns are addressed? This is the negative theme. Your DNA is your story, past, present, and future, written in code. Now imagine handing that story to a machine with no clear laws on how it should be read. This is the crossroads we're standing at today. Genomics, the study of complete set of DNA within an organism, isn't just about genes, it's about understanding how they function, interact, and shape who we are. According to the National Human Genome Research Institute, genomics offers a powerful lens into our biological blueprint. In humans, this data provides profound insight into our predisposition for conditions like cancer, diabetes, and rare genomic disorders. It enables earlier diagnosis, more precise treatments, and even the possibility of predicting diseases before symptoms arise. But as this powerful technology meets artificial intelligence, we're forced to ask, are we ready for what happens next? But genomic data is unlike any other kind of information. It's personal, permanent, and uniquely identifiable, not just to you, but often to your family. Once compromised, it cannot be reset or changed. This makes protecting it not just a technical challenge, but an ethical imperative. Enter artificial intelligence. AI is now transforming how we analyze genomic data, scanning millions of DNA sequences in seconds, spotting patterns that humans might miss, and predicting health risks with astonishing speed and precision. But this power comes with risk. Without strict ethical safeguards, AI in national genomic strategies could open the door to genomic surveillance, genetic discrimination, and widening health inequalities. This misuse of this technology doesn't just threaten individuals' privacy, it threatens public trust, social justice, and the very fabric of healthcare equity. So the question isn't just whether we can use AI in genomics, it's whether we're doing it responsibly. History has taught us that innovation without oversight can come at a devastating cost. The history of medical research is filled with unethical conduct, from the Tuskegee syphilis study, where treatments was knowingly withheld from black men for decades, to the thalidomide tragedy, where a lack of proper testing led to thousands of birth defects. These cases reminded us that scientific progress without ethics is not progress at all. Today, as we stand on the edge of a new era in genomic medicine powered by AI, we must remain vigilant. Without a clear ethical safeguard, we risk repeating past mistakes on an even larger scale. Genomic surveillance, genetic discrimination, and worsening health disparities are not distant possibilities, they are real threats. That's why robust ethical frameworks, regular oversight, and inclusive dialogue are not optional, they are essential. Because this time the stakes are not just experimental, they are permanent, they are personal, and they affect us all. Genomic diagnosis reveals more than just a medical condition, it uncovers a person's entire biological blueprint. Unlike standard medical records, genomic information is predictive, deeply personal, and shared across generations. And once it's exposed, there is no going back. It cannot be changed, revoked, or reissued. Now, artificial intelligence is stepping into the space, offering extraordinary capabilities. It can process massive, complex genetic dataset with speed and precision beyond anything we have ever seen before. It holds the potential to revolutionize diagnosis, improve outcomes, and personalize medicine. But here's the reality: this field is still in its infancy, driven by experimental algorithms, rapidly evolving software, and immense data infrastructure that are often opaque, unregulated, and biased. In this moment of opportunity and uncertainty, we face critical decisions. Should we embrace AI's potential to transform genomic medicine, or pause until we can guarantee that its use will be ethical, equitable, and safe? We're placing immense trust in artificial intelligence technology that's still new, imperfect, and largely unregulated to manage the most intimate, irreversible data we possess, our genetic code. And yet we're doing so without first building an ethical foundation. This responsibility demands protection around privacy, informed consent, data equity, and accountability are still fragmented or missing altogether. In the race to innovate, we risk turning genomic data from a tool for healing and hope into a weapon for discrimination, surveillance, and division. This is not a call to hold progress, it's a call to proceed with wisdom until these urgent ethical concerns are fully and responsibly addressed. The use of AI in national genomic policies must be restricted not to hinder science but to protect the people it's meant to serve. Genomic data is uniquely personal and permanently identifiable. Once exposed, it cannot be changed and affects not just individuals but entire families. Yet we're feeding this sensitive info into AI systems that remain opaque, immature, and often biased, as shown in studies. Meanwhile, ethical and legal safeguards haven't kept pace with the rapid innovation. There is still no clear consequences on consent, privacy, and accountability. And public trust, which is essential for national genomic program, could collapse if AI is misused. Most concerning is dual use risk. The same tools that protect disease could be used to weaponize or as a weapon for surveillance or even by warfare. Until these dangers are fully addressed, AI should not be integrated into national genomic policies. Our second argument focuses on privacy and control. AI can infer sensitive info far beyond what an individual originally consented to, making it a serious threat to privacy and the individual, family, and even societal level. Yet authorizations and control over genomic data remain weak, especially in lower resource settings. Take Uganda, for example, while National Council for Science and Technology reviews genomic research and enforcement is limited, and regulations around AI use are still underdeveloped. AI also amplifies the risks of data breaches and misuse. Once genomic data is exposed, the consequences are irreversible. And today, ethical proofs for AI in genomics are inconsistent worldwide. There is no unified standard, leaving too much room for error and exploitation. Without robust governance, AI use in genomics poses a clear and escalating risk. And scale of genomic data, but as one ethicist put it, progress without protection is reckless. AI systems today are not neutral. They are mostly trained on genomic data from European populations, leading to biased and inaccurate predictions for underrepresented groups, specifically in Africa. According to Nature 2021, over 80% of genome-wide association studies are Eurocentric. Even when AI identifies a mutation, it often can't explain the link to disease, leaving patients and doctors with more questions than answers. And globally, many countries still lack clear legal frameworks for using AI in genomics. As WHO warned in 2021, this gap puts population at risk. We have already seen AI systems causing racial and social harm in healthcare. Until these issues are fixed, trusting AI with our most sensitive data is not just risky, it's irresponsible. AI's ability to improve diagnostic accuracy and speed is often overstated. AI performs poorly when trained on biased or limited datasets. Research by Carr and al. shows that if AI is only trained on certain populations, it can miss crucial patterns in others. AI can also overfit to training data, detecting non-disease patterns, or even producing false positives, as noted by Tobol 2019. This can lead to unnecessary treatments or misdiagnosis. Moreover, many AI diagnostic models are not rigorously validated in real-world clinical settings. Without testing in diverse practical environments, we can't be sure of their accuracy. Finally, the critical question remains who's responsible if AI gets a diagnosis wrong? Is it the doctor, the developer, or the system itself? Until these accountability issues are addressed, we can't blindly trust AI with our health. While AI promises personalized medicine, it often excludes underrepresented populations such as African and indigenous groups. Some studies highlight these populations are frequently left out of genomic research, leading to ineffective or even harmful personalization. Moreover, personalized medicine risks becoming mispersonalized if AI fails to account for the full genetic and environment diversity of patients without the nuanced treatment plans could be tailored based on incomplete or biased data, ultimately undermining their effectiveness. Countries like the UK, US, and Singapore have robust infrastructure, strong data governance, and advanced healthcare systems that can support AI in genomics, as noted by the WHO 2021. But what's acceptable in those nations may violate ethical norms or legal protections in other parts of the world. Different countries have different values, standards, and legal frameworks, and AI applications that work in one setting may not be ethically or legally viable in another. We cannot apply a one-size-fits-all approach to genomic AI. It must be tailored to the specific needs and protections of each country. Genomic data holds the deepest secrets of our identity. It's permanent, predictive, and profoundly personal. Handing it over to an immature, unregulated AI system without strong ethical safeguards is not progress. It's reckless experimentation with human lives. Without ethics first, there can be no true innovation, only exploitation, mistrust, and irreversible harm. Therefore, these ethical concerns are fully and responsibly addressed. The use of AI in national genomic policies must be restricted. Here are some references I used in our presentation. Thank you so much for listening, and now we open the floor for Q&As.